Mother Bear stopped the surgery. Midway, to protect a tiny patient, what happened next was shocking. Let us know where you're watching from. If you love my content, consider supporting it with a super thanks. Also, don't forget to like and subscribe. It'll help us to remain in touch with amazing people like you. The rain hammered against the windows of the Wildwood Veterinary Clinic like bullets, each drop exploding against the glass in a rhythm that matched Dr. Kieran Vale's racing heartbeat. He had been a wilderness veterinarian for 12 years, but tonight felt different. Tonight felt like the kind of night where everything could go wrong. "Hand me the scalpel," Kieran whispered to his assistant Zara Chen, who had been working alongside him for only 3 months. Her hands trembled slightly as she passed the instrument, the metal catching the harsh overhead lights. The small bear cub on the operating table looked so fragile, so impossibly tiny against the cold steel surface. Its fur was matted with dried blood, and each shallow breath it took seemed like it might be its last. The cub had been found by park rangers that morning, unconscious near a hiking trail with deep gashes across its side. No mother bear in sight, no siblings. Just this little life hanging by a thread, brought to Kieran's clinic because he was the only veterinarian within 100 miles who specialized in wild animals. "Its pulse is weak," Zara said, her voice barely audible above the storm outside. She checked the monitors for the 3rd time in 2 minutes, her eyes reflecting the green glow of the screens. "Dr. Vale, are you sure we shouldn't wait until morning? Maybe contact the Wildlife Rescue Center?" Kieran shook his head, focusing the surgical light on the cub's wounds. "This little one doesn't have until morning. Look at these injuries, Zara. Something attacked it, and these wounds are infected. If we don't operate now, we'll lose it." The cub stirred slightly, letting out a sound so soft it was almost lost beneath the storm's roar. But Kieran heard it, and something deep in his chest tightened. He had saved countless animals over the years, but there was something about this cub that felt personal. Maybe it was the way it had looked at him when they first brought it in, those dark eyes holding a wisdom that seemed too old for such a small creature. "Beginning the procedure," Kieran announced, more to calm his own nerves than to inform Zara. The first incision was clean, precise. Blood welled up immediately, and Zara was ready with gauze, dabbing it away so Kieran could see what he was working with. That's when they heard the first sound. It was low, distant, almost lost in the storm's fury. But it was there, a deep, guttural noise that seemed to vibrate through the very walls of the clinic. Zara's head snapped up, her eyes wide with sudden fear. "What was that?" she whispered. Kieran paused, his scalpel hovering over the cub's tiny body. He listened, straining to hear over the rain and wind. For a moment, there was nothing but the storm. Then it came again, closer this time. A sound that made every primitive instinct in his body scream danger. "Probably just the wind," he said, but his voice lacked conviction. He knew that sound. Every veterinarian who worked with wild animals knew that sound. It was the call of a mother looking for her child. The cub on the table suddenly twitched, its little paws moving as if it was trying to run. Even unconscious, even sedated, something was calling to it. Kieran felt a chill run down his spine that had nothing to do with the cold night air seeping through the clinic's old windows. "Dr. Vale?" Zara's voice was tight with anxiety. "Maybe we should—" The lights flickered, once, twice, then held steady. But in that moment of darkness, they both heard it clearly. Heavy footsteps on the wooden porch outside. Slow, deliberate, and far too heavy to be human. Kieran's hands stilled completely now. In 12 years of practicing wilderness veterinary medicine, he had encountered bears before. Usually, they kept their distance from human settlements. Usually, they didn't come looking for their cubs in the middle of surgical procedures. Usually, they didn't make sounds like the one that just shook the building's foundation. "Zara," he said quietly, "I need you to very slowly walk to the supply cabinet and get the tranquilizer gun. Don't make any sudden movements." But before Zara could take even a single step, the sound came again. This time, it wasn't distant. This time, it was right outside the door. The cub on the table suddenly opened its eyes. Those eyes were not the confused, drugged eyes of an animal coming out of anesthesia. They were alert, focused, and staring directly at the front door of the clinic. The little bear's head turned slightly and it made a sound. Not the weak whimper they had heard before, but something else entirely. Something that sounded almost like a response to whatever was outside. Kieran felt his blood turn to ice. In all his years of veterinary practice, he had never seen an animal react like this while under sedation. The monitors showed the cub's heart rate spiking, but its breathing remained steady. It was as if the little bear was fighting through the anesthesia through sheer will alone. "That's impossible," Zara whispered, her voice trembling. "The dosage I gave it should keep it unconscious for at least 3 more hours." The footsteps outside grew louder, accompanied by a sound that made both humans freeze completely. It was the sound of wood creaking, straining under an enormous weight. The old porch of the clinic had been built to support humans, not something that sounded like it weighed several hundred pounds. "Dr. Vale?" Zara's voice was barely a breath now. "That thing outside, it's not just any bear, is it?" Kieran couldn't answer. His mind was racing through everything he knew about bear behavior, about maternal instincts, about the lengths a mother would go to protect her young. But none of his textbook knowledge had prepared him for this. Bears didn't track their cubs to veterinary clinics. Bears didn't stand on porches in the middle of storms, waiting. Bears didn't make their unconscious cubs wake up just by being near. The cub on the table suddenly tried to sit up, its small body fighting against the restraints they had placed to keep it still during surgery. The 4th line in its tiny leg pulled taut, and Kieran quickly reached to steady it, afraid the cub might injure itself further. "Easy, little one," he whispered, but the moment his hand touched the cub's fur, something extraordinary happened. The animal didn't struggle against his touch. Instead, it looked directly into his eyes, and Kieran could swear he saw something there that looked almost like gratitude. Trust? It was impossible to tell, but the cub's body relaxed slightly under his hand. That's when the first window exploded. Glass shattered across the clinic floor as something massive struck the window beside the operating table. Not struck, pressed. Through the jagged opening, Kieran could see the outline of an enormous head and 2 eyes that reflected the clinic's lights like mirrors. The mother bear had found them. But she wasn't attacking, she was looking. Her massive head pushed through the broken window just enough to see the operating table, to see her cub, to see the 2 humans standing frozen in terror. And then she did something that made Kieran's knees nearly buckle. She whimpered. It was the same sound her cub had been making earlier, but deeper, more desperate. It was the sound of a mother who had been searching all day and night for her baby, who had followed some invisible trail through miles of wilderness and storm to find this small building with its bright lights and strange smells. The cub on the table responded immediately, making that same sound back to its mother. The monitors went crazy as the little bear's heart rate spiked even higher, but somehow, impossibly, the cub seemed to be getting stronger, not weaker. "Zara," Kieran said slowly, never taking his eyes off the massive bear head in the window, "I need you to listen to me very carefully. I don't think this mother bear is here to attack us. I think she's here because she knows her cub is hurt, and she's trying to help. help?" Zara's voice cracked. "Dr. Vale, that thing could kill us both with one swipe of its paw." "Look at her," Kieran said softly. "Really look at her." Zara forced herself to look at the bear's face in the window. What she saw there wasn't rage or aggression. It was fear, desperation. Love so fierce it had driven this wild animal to break every instinct that told it to avoid humans, to instead seek them out in the hope they could save her baby. The mother bear's eyes moved from her cub to Kieran, and he felt something pass between them, an understanding that transcended species. She wasn't here to take her cub away. She was here to make sure the humans understood how precious this little life was. "She's been following us," Kieran realized suddenly. "She's been watching from the forest, waiting to see if we were going to help or hurt her baby. And when she saw us operating, when she saw the lights and the equipment, she made a decision." "What kind of decision?" Zara asked, though she wasn't sure she wanted to know the answer. Kieran looked down at the cub, whose wound was still partially open, still bleeding. They were only halfway through the surgery and they had a choice to make. They could try to sedate the mother bear, complete the operation with her unconscious outside. Or they could do something that went against every protocol, every safety measure, every rule of veterinary medicine. They could let the mother bear stay and watch. "Zara," Kieran said quietly, "I need you to open the front door." "Are you insane?" Zara's voice rose to nearly a shout. That bear could have broken down our door 10 minutes ago if she wanted to hurt us," Kieran interrupted. "She could have smashed through this window completely instead of just putting her head through. She could have done a dozen things to get to her cub by force. But she didn't. She's asking permission." The mother bear's eyes were still locked on Kieran's, and he could see something there that made his chest tight with emotion. She was trusting him. This wild animal, this creature who had every reason to see humans as a threat, was putting her faith in his ability to save her baby. "The tranquilizer gun," Zara said weakly. "At least let me get the tranquilizer gun." Kieran shook his head. "If we're going to do this, we do it with trust, not weapons. She's not our enemy, Zara. She's another parent trying to save her child." The cub on the table made another sound, weaker this time, and both humans saw the mother bear's massive head push further through the window. She was trying to get closer to her baby, trying to comfort it the only way she could. "The blood loss is getting worse," Zara said, checking the monitors. "If we don't finish this surgery soon." "Then we finish it," Kieran said firmly. "But we do it with her watching. We do it with her knowing that we're trying to save her baby, not hurt it." Zara looked at him like he had lost his mind. "Dr. Vale, there's no protocol for performing surgery with a wild bear in the room. There's no training for this. There's no protocol for a lot of things," Kieran said gently. "Sometimes you have to trust your instincts." The mother bear made another sound, softer this time, and her cub responded. It was a conversation in a language older than words, a communication that spoke of love and protection and hope. And somehow, impossibly, Kieran understood it. "She's not going to hurt us," he said with absolute certainty. "She's going to help us save her baby." But even as he said it, Kieran knew they were about to cross a line that could never be uncrossed. They were about to invite a wild animal into their sterile world, to trust their lives to a creature they barely understood. And the most terrifying part wasn't the possibility that the bear might attack them. The most terrifying part was that Kieran was starting to believe they might actually need her help to save the cub's life. The decision hung in the air like the storm clouds outside, heavy and electric with possibility. Kieran looked at the cub, whose breathing had become more labored in the past few minutes. The little bear's eyes kept darting between him and the window where its mother waited, and there was something in that gaze that spoke of a connection deeper than anything Kieran had ever witnessed between a human parent and child. "Zara," he said finally, his voice steady despite the chaos in his mind. "Open the door, but move slowly and keep your hands visible." "Dr. Vale, I can't." "You can," Kieran said firmly. "And you will, because that cub is dying, and I think its mother knows something we don't." Zara's hands shook as she moved toward the front door of the clinic. Each step felt like it took an eternity, and she could hear her own heartbeat drumming in her ears. The mother bear's massive head followed her movement through the broken window, those intelligent eyes tracking every gesture. When Zara's hand touched the door handle, the mother bear made a sound, low and rumbling, but not threatening. It sounded almost like encouragement. Zara turned the handle and slowly pulled the door open. What happened next defied everything they thought they knew about wild animals. The mother bear didn't charge into the clinic. She didn't rush toward her cub or try to grab it and run. Instead, she moved with deliberate care, her massive frame somehow seeming gentle as she approached the threshold. She paused at the doorway, looking directly at Kieran, and made another sound. A questioning rumble that seemed to ask permission. "It's okay," Kieran found himself saying, though he wasn't sure if he was talking to the bear or to himself. "Come in. Come see your baby." The mother bear entered the clinic with steps so careful they barely made a sound on the wooden floor. She was enormous, easily 6 feet tall even on all fours, with muscles that rippled under her thick brown fur. But her movements held a tenderness that took Kieran's breath away. She approached the operating table like a human parent might approach their child's hospital bed, desperate to be close, but afraid of causing harm. When she reached the table, something miraculous happened. The cub, who had been growing weaker by the minute, suddenly perked up. Its little head lifted, and it made a sound of pure joy at seeing its mother. The monitors showed an immediate improvement in the cub's vital signs, heart rate stabilizing, breathing becoming deeper and more regular. "That's impossible," Zara whispered from her position by the door. The presence of the mother shouldn't affect the cub's medical condition like that. But Kieran was beginning to understand that they had entered territory where medical textbooks meant nothing. He was watching something that science couldn't explain, the power of love to literally heal, to give strength where there had been weakness, to provide hope where there had been despair. The mother bear positioned herself so she could see both her cub and Kieran clearly. Then she did something that made both humans gasp. She gently placed one massive paw on the edge of the operating table, not touching her cub but close enough to offer comfort, and looked directly at Kieran. The message was clear. "I trust you. Save my baby." She's giving us permission to continue, Kieran realized. She's telling us she understands what we're trying to do. With the mother bear watching, Kieran returned to the surgery with renewed focus. But as he prepared to make the next incision, the mother bear made a sound, sharp and urgent. Kieran's hand froze. "What is it?" Zara asked nervously. The mother bear was staring intently at the cub's wound, her nose twitching as if she was scenting something. Then she made the sound again, more insistent this time, and actually nudged Kieran's hand away from where he had been about to cut. "She doesn't want me to operate there," Kieran said in amazement. "She's trying to tell me something about the wound." Kieran looked more carefully at the area where the mother bear had directed his attention. At first glance, it looked like the rest of the injury, torn flesh that needed cleaning and stitching. But as he examined it more closely, using a magnifying lens, he saw something that made his blood run cold. "Zara, bring me the ultrasound machine. Now." "What do you see?" "I'm not sure yet, but I think Kieran positioned the ultrasound probe over the area the mother bear had indicated. The image that appeared on the screen made him stagger backward. "Oh my God! What is it?" Zara rushed over to look at the monitor. There, clearly visible on the ultrasound, was a piece of metal embedded deep in the cub's side, a fragment from what looked like a steel trap. But that wasn't the worst part. The worst part was its position. The metal shard was less than a centimeter away from the cub's heart. "If I had cut where I was planning to cut," Kieran said slowly, "I would have pushed that fragment directly into the heart. The cub would have died instantly." They both looked at the mother bear, who was watching them with those impossibly intelligent eyes. She had known. Somehow, she had sensed what their instruments had missed, what their medical training had overlooked. She had guided them away from a fatal mistake. "How did she know?" Zara asked in a voice filled with wonder. "I don't know," Kieran admitted. "But she saved her baby's life by stopping us." The cub made a soft sound, and its mother responded by gently nuzzling the side of its head with her massive snout. The little bear's eyes fluttered closed, but this time it wasn't from weakness. It was from comfort, from the absolute security of knowing its mother was there. "We need to remove that fragment," Kieran said, studying the ultrasound image. "But it's going to be incredibly delicate work. One wrong move." The mother bear seemed to understand the gravity of the situation. She positioned herself even closer to the table, her presence radiating a calm strength that seemed to fill the entire room. And then she did something that brought tears to Kieran's eyes. She began to hum. It was a low, rhythmic sound that seemed to resonate in her chest, a lullaby that only a mother could sing. The cub's breathing immediately synchronized with the rhythm of her humming, and the monitors showed all of its vital signs stabilizing at optimal levels. "She's regulating its heartbeat," Zara said in amazement. "She's keeping it calm for the surgery." Kieran had never experienced anything like this in his entire career. He was performing surgery on a wild animal, while its mother provided anesthesia through pure maternal instinct. It went against everything he had been taught about veterinary medicine, about the separation between wild animals and human intervention, about the impossibility of communication across species. But as he began the painstaking process of extracting the metal fragment, guided by the mother bear's watchful eyes and soothed by her gentle humming, Kieran realized he was witnessing something that would change him forever. This wasn't just about saving one small bear's life. This was about understanding that the boundaries between species, between wild and domestic, between animal and human, were far more fluid than anyone had ever imagined. The fragment was coming loose, but as Kieran worked, he noticed something else on the ultrasound that made him pause. There was another shadow, deeper in the cub's chest cavity, something that didn't belong there. "Zara," he said quietly, not wanting to alarm the mother bear, "I think there's something else, something we missed in the initial examination." But before Zara could respond, the mother bear's humming stopped abruptly. She lifted her head and looked directly at the ultrasound screen, as if she could interpret the medical images as clearly as any trained veterinarian. Then she looked at Kieran and made a sound, soft, but filled with urgency. She knew there was more. She had known all along. The question was, what else was hiding inside her cub's tiny body, and would they be able to find it in time? Kieran adjusted the ultrasound probe, his hand steadier now despite the impossible circumstances. The mother bear had positioned herself so she could see both the screen and her cub, her dark eyes moving between the two with an intelligence that made Kieran's spine tingle. As the image on the monitor became clearer, what he saw made him question everything he thought he knew about this case. "That's not possible," he whispered, leaning closer to the screen. The shadow wasn't another piece of metal or debris from the trap. It was organic, but it didn't belong to the cub. The shape was wrong, the texture different, and it seemed to be moving. Kieran increased the magnification, and what he saw made his knees weak. "Zara, look at this," he called, his voice tight with disbelief. "Tell me what you see." Zara peered at the monitor, her eyes squinting as she tried to make sense of the grainy image. "It looks like, is that another animal inside the cub?" The mother bear made a sound. Not her gentle humming, but something else entirely. It was a sound of recognition, of confirmation. She knew exactly what they were looking at, and she had been waiting for them to discover it. "It's not possible for another animal to be inside," Kieran began, but then the shadow on the screen moved again, more distinctly this time. It had a tiny heartbeat separate from the cub's. It had its own respiratory pattern, and as impossible as it seemed, it appeared to be alive. "Doctor, Vale," Zara's voice was barely a whisper. I think the cub is pregnant." The words hung in the air like a physical presence. Kieran stared at the ultrasound screen, his mind racing through the implications. The cub couldn't be more than 8 months old, far too young for pregnancy. But the evidence was right there on the monitor. A tiny, separate life growing inside an already impossibly small patient. The mother bear seemed to sense their confusion and shock. She moved closer to the operating table and gently nudged the cub's belly with her nose, then looked directly at Kieran. Her message was clear. "Yes, you understand now. There are 2 lives you need to save." "But how?" Zara asked, voicing the question that was tearing through Kieran's mind. "Cubs this young don't reproduce. It's biologically impossible." Kieran looked more carefully at the cub on the table, really studied its features for the first time since the surgery began. What he had assumed was a very young cub based on its size might not be accurate. Bears could be smaller than average due to malnutrition, illness, or genetics. Could this cub actually be a young adult female, stunted by some condition that made her appear much younger? "Check the dental development," he told Zara urgently, "and look at the bone structure in the legs." As Zara performed the additional examinations, the mother bear watched intently, occasionally making soft sounds that seemed to encourage their investigation. It was as if she was guiding them toward a truth she had been trying to communicate all along. "Dr. Vale," Zara's voice was filled with amazement. "You're right. Based on the bone density and tooth development, this isn't a cub. This is a young adult female, probably around 2 years old, but she's severely malnourished, which is why she appeared so much smaller and younger." The pieces of the puzzle were starting to fit together, but they created a picture that was more heartbreaking than anyone could have imagined. This wasn't just a mother trying to save her baby. This was a grandmother trying to save both her daughter and her unborn grandchild. The trap, Kieran realized suddenly. She was caught in a trap while trying to forage for food. She's been starving, which is why she's so small. And the stress of the injury, combined with malnutrition, could cause complications with the pregnancy, Zara finished. The baby might not be getting enough nutrients to develop properly. The mother bear seemed to understand that they were finally grasping the full scope of the situation. She made a sound that was almost like a sigh of relief, as if she had been carrying this burden of knowledge alone for too long. But as Kieran prepared to continue the surgery with this new information, something else happened that no one could have predicted. The young female on the table opened her eyes, not the drugged, confused eyes they had seen before, but fully alert and aware eyes that looked directly at her mother. And then she spoke. Not in words, of course, but in a series of sounds that were clearly communication. The mother bear responded immediately, and what followed was a conversation that Kieran and Zara could only watch in stunned silence. The two bears were discussing something, their voices rising and falling in patterns that suggested questions, answers, reassurances, and decisions. They're talking about the surgery, Kieran realized. The mother is telling her daughter what's happening, and the daughter she's giving consent. It was a moment that redefined everything Kieran thought he knew about animal intelligence, about communication across species barriers, about the bonds that connected mothers and children regardless of species. He was witnessing a family meeting in the middle of an operating room, watching two wild animals make informed decisions about medical treatment. The conversation between mother and daughter continued for several minutes, with the mother bear occasionally gesturing toward Kieran and Zara with her massive head. At one point, the young female looked directly at Kieran and made a sound that was unmistakably acknowledgement, even gratitude. "I think," Kieran said slowly, "she's thanking us for trying to help." But the mother bear wasn't finished. She moved to the other side of the operating table and did something that made both humans gasp. She carefully placed one paw on her daughter's head and the other on her daughter's belly, right where the ultrasound had shown the unborn cub. Then she looked at Kieran and made a sound that was both a request and a command. "She wants us to save them both," Zara whispered. "But Dr. Vale, the complications, performing surgery on a pregnant patient, especially one this malnourished and injured, the risks are enormous." Kieran nodded, understanding the medical challenges they faced. Operating on the young female to remove the metal fragment was dangerous enough, but doing so while she carried a baby, while she was weakened by starvation and blood loss, while her body was already under incredible stress, it was the kind of case that could destroy a veterinarian's career if it went wrong. But as he looked at the mother bear's face, at the trust and desperation in her eyes, as he watched the young female on the table fighting to stay conscious despite the anesthesia, as he thought about the tiny life depending on their decisions, Kieran knew there was only one choice he could make. "We save them both," he said firmly. "We find a way to save all three of them." The mother bear seemed to understand his words, because she moved back to her position beside the table and resumed her gentle humming. But this time, the rhythm was different, more complex, as if she was now singing a lullaby for two patients instead of one. As Kieran prepared to continue the surgery, now with the knowledge that he was operating on two patients instead of one, he noticed something else on the ultrasound that made his heart skip a beat. The metal fragment that had been dangerously close to the young female's heart was moving. Not because of anything he was doing, but because her body was shifting it, and it was moving in the direction of the unborn cub. "Zara," he said urgently, "we need to get that fragment out now. If it shifts much more, it's going to pierce the amniotic sac." But as he reached for his instruments, the mother bear suddenly stood up on her hind legs, towering over the operating table at her full height of nearly 8 feet. Her eyes were fixed on something outside the clinic, and the sound she made was unlike anything they had heard from her before. It was a warning. Through the broken window, Kieran could see lights approaching through the storm. Vehicle headlights, moving fast and heading directly toward the clinic. And from the distant sound of engines and radio chatter, he could tell they weren't alone. "The park rangers," Zara said, her face pale with realization. "Someone must have reported seeing the bear tracks leading here. They're coming to rescue us." But the mother bear's reaction made it clear that rescue was the last thing any of them needed right now. The arrival of more humans, especially armed park rangers with tranquilizer guns and protocols for dealing with dangerous wildlife, could destroy everything they had built in this room. The trust, the cooperation, the miracle of communication across species, all of it could be shattered in seconds. "They'll separate them," Kieran realized with horror. They'll tranquilize the mother bear and take her away. They won't understand what's happening here." The young female on the table seemed to sense the approaching danger, too. Her eyes snapped open again, and she made a sound of distress that immediately brought her mother back down to all fours. The two bears looked at each other, then at Kieran and Zara, and the message in their eyes was unmistakable. "Help us, before it's too late." The lights were getting closer, and Kieran could now hear voices shouting over the storm. He had perhaps 5 minutes before the Rangers reached the clinic, 5 minutes to remove a metal fragment that was threatening 2 lives, 5 minutes to prove that sometimes the most impossible solutions were the only ones that worked. But as he picked up his scalpel, the young female did something that changed everything once again. She reached out with one small paw and gently touched his hand, her claws carefully sheathed so she wouldn't hurt him. The gesture was so human, so filled with trust and hope, that Kieran felt tears blur his vision. In that moment, he understood that this wasn't just about saving 2 bears anymore. This was about proving that love, trust, and understanding could transcend every barrier that evolution and civilization had created between species. This was about showing that sometimes miracles happened not in spite of impossible circumstances, but because of them. The question was, could he perform that miracle in the next 5 minutes before the outside world crashed in and destroyed everything they had built together? Kieran's hands moved with a precision born of desperation and purpose. The metal fragment was visible now through the incision, a jagged piece of steel that gleamed wickedly under the surgical lights. But what made his heart race wasn't just the danger it posed to the young female. It was how close it had drifted to the area where the unborn cub was developing. "Pulse is spiking," Zara announced, her eyes darting between the monitors and the approaching headlights outside. "Both heartbeats are becoming irregular." The mother bear sensed the urgency, too. Her humming became more intense, more focused, and she positioned herself so that her massive body blocked the view from the windows. It was as if she understood that they needed privacy for what was about to happen, that the approaching humans represented a threat to more than just their physical safety. "Dr. Vale," Zara whispered urgently, "what if the Rangers won't listen? What if they see this as a dangerous situation and act first, ask questions later?" Kieran didn't answer because he was concentrating on the most delicate surgery of his career. The fragment had to be extracted at precisely the right angle to avoid damaging the surrounding tissue, but also to prevent it from shifting toward the unborn cub. One wrong move could kill both patients instantly. The young female's eyes remained open, watching his every movement. There was something almost supernatural about her awareness during the procedure, as if the urgency of the situation was keeping her conscious despite the anesthesia. Every few seconds, she would make a soft sound to her mother, who would respond with reassuring rumbles. "Got it," Kieran breathed as he carefully grasped the fragment with surgical forceps. But as he began to extract it, something happened that no medical textbook could have prepared him for. The unborn cub moved. It wasn't just the normal movement of a developing baby. This was deliberate, purposeful movement that seemed to be in response to its mother's distress. The ultrasound showed the tiny form actually pushing against the walls of the amniotic sac, as if it was trying to help with its own rescue. "That's impossible," Zara gasped, staring at the monitor. Fetal movement at this stage of development shouldn't be that coordinated. But the mother bear didn't seem surprised at all. She leaned closer to her daughter and made a series of sounds that seemed almost like instructions. The young female responded, and incredibly her body relaxed in a way that made the extraction easier. They're communicating about the surgery, Kieran realized. The grandmother's telling the mother how to help, and the mother is somehow communicating with her unborn baby. The fragment came free with a soft sucking sound, and immediately both heartbeats on the monitor stabilized. But Kieran's relief was short-lived because the sounds outside were getting much closer now. Vehicle doors slamming, boots on gravel, voices calling through the storm. Wildwood Veterinary Clinic, this is Park Ranger Station 7. We received reports of a dangerous bear in the area. The mother bear's entire demeanor changed instantly. Her hackles rose, her ears flattened against her head, and she let out a low growl that vibrated through the floor of the clinic. But she didn't move away from the operating table. Instead, she positioned herself even more protectively between her family and the approaching voices. "We have to let them in," Zara said frantically. "If we don't respond, they'll assume we're in danger and break down the door. And if we do let them in, they'll see this situation and panic," Kieran replied, his hand still working to close the surgical incision. "They'll tranquilize the mother bear and separate the family. The young female is still too weak to survive without her mother's presence." The young female seemed to understand the approaching crisis because she suddenly tried to sit up on the operating table, her maternal instincts overriding her physical weakness. The movement pulled at her stitches, and fresh blood began to seep through the surgical site. "Easy, Mama," Kieran said softly, using his gentlest tone. "Your baby needs you to stay still, just a little longer." But the young female's distress was triggering something profound in her mother. The grandmother bear began to pace, her massive form moving restlessly around the operating room. With each step, the floorboards creaked ominously, and surgical instruments rattled on their trays. "Dr. Vale, are you in there? We're coming in." The ranger's voice was much closer now, probably right outside the front door. That's when the young female did something that changed everything once again. She lifted her head and called out. Not to her mother, not to Kieran or Zara, but toward the door where the rangers waited. It was a sound unlike anything they had heard from her before, a vocalization that seemed to carry layers of meaning. The response from outside was immediate and shocking. The voices stopped. The footsteps stopped. Even the sound of radio chatter ceased completely. "What did she just say to them?" Zara asked in amazement. The mother bear had stopped pacing and was looking toward the door with what could only be described as satisfaction. She made a sound back to her daughter, who responded with a weaker but equally complex vocalization. They're talking to the rangers," Kieran said in disbelief. "Somehow, they're communicating with the humans outside." Through the broken window, they could see the beams of several flashlights, but the rangers weren't approaching anymore. Instead, they seemed to be having an urgent discussion among themselves. Fragments of conversation drifted through the storm. "Never heard anything like that before. Not aggressive behavior. Protocol says we should. But if they're communicating..." The young female called out again, and this time Kieran could swear he heard something almost like words in her vocalizations. Not human words, but patterns and rhythms that seemed structured, intentional, meaningful. One of the rangers called back, his voice uncertain but attempting to match the rhythm of the bear's communication. We hear you. Are you asking for help?" The answer from the young female was immediate and unmistakable. It was the sound equivalent of yes. "My God," Zara whispered. "She's learned to communicate with humans. Somehow, she's picked up enough human vocal patterns to make herself understood." The conversation that followed was unlike anything in recorded history. A human park ranger and a wild bear, conducting a dialogue across species barriers that science insisted were absolute. The young female managed to convey that she was injured, that she had babies, using sounds that clearly indicated plurality, and that the humans inside the clinic were helping her. The ranger who had been responding seemed to be the senior member of the team, because Kieran could hear him giving orders to the others. "Stand down. Do not approach the building. We're dealing with something unprecedented here." "But, sir," another voice protested. "Protocol clearly states—" "Protocol doesn't cover this situation," the senior ranger interrupted. "I've been working with wildlife for 20 years, and I've never seen or heard anything like this. These bears are asking for our help, not threatening us." Inside the clinic, the mother bear seemed to relax slightly at the ranger's decision to maintain distance. She returned to her position beside the operating table and resumed her gentle humming, but her eyes remained alert and watchful. Kieran was able to complete the suturing of the young female's wound, but as he worked, he noticed something on the ultrasound that made him pause. The unborn cub's position had shifted again, but this time in a way that suggested a problem. "Zara, look at this. The baby's heart rate is dropping." The young female must have sensed something was wrong because she began to make distressed sounds, calling to her mother with increasing urgency. The mother bear responded by placing her paws on either side of her daughter's belly, applying gentle pressure in a rhythmic pattern. "She's trying to stimulate the baby," Kieran realized. "She's massaging the womb to encourage the baby's heartbeat." The technique was working. The unborn cub's heart rate began to stabilize under the grandmother bear's ministrations. But as Kieran watched the ultrasound monitor, he saw something else that made his blood run cold. There wasn't just one baby. "Zara," he said quietly, adjusting the ultrasound probe to get a better view, "I need you to look at this very carefully and tell me what you see." Zara leaned over the monitor, her eyes scanning the grainy image. "I see the baby we've been monitoring, but there's— Wait, is that a second heartbeat?" "Count them," Kieran said grimly. As Zara studied the screen more carefully, her face went pale. "I count 3 separate heartbeats. Dr. Vale, she's carrying triplets." The mother bear seemed to know they had made this discovery because she looked directly at Kieran and made a sound that could only be interpreted as confirmation. Her message was clear. Yes, 3 babies. All precious. All must be saved. But that's— Zara struggled to process the implications. Triplets in bears are extremely rare, and with her malnourished condition, the chances of all 3 babies surviving to term are probably 0 under normal circumstances, Kieran finished. But nothing about this situation has been normal. Outside, they could hear the rangers setting up some kind of perimeter, their voices discussing how to handle a situation that had no precedent. Inside the clinic, Kieran faced the most complex medical challenge of his career: keeping a malnourished, injured young mother alive while ensuring the survival of 3 unborn cubs who were developing in conditions that should have been impossible. The young female seemed to understand the gravity of her situation because she reached out again and touched Kieran's arm, her claws carefully sheathed. When he looked into her eyes, he saw something that took his breath away. She wasn't just asking him to save her babies, she was asking him to save the future of her family, her lineage, her species' presence in this small corner of the world. In her eyes, he saw the weight of every mother who had ever entrusted her children to someone else's care, the desperation of every parent who had ever said, "Please, do whatever it takes." But as Kieran prepared to monitor the 3 unborn cubs more closely, something happened outside that changed everything once again. A new vehicle arrived, its engine sound different from the park ranger's trucks. This one was bigger, heavier, and from the sound of multiple doors slamming, it carried more people. "Dr. Vale," came a new voice through the storm, authoritative and commanding. "This is Dr. Sarah Martinez from the State Wildlife Research Division. I need to speak with you immediately about the situation you have in there." The mother bear's reaction was immediate and alarming. She rose to her full height again, but this time her growl was deeper, more threatening. Something about this new arrival had triggered every protective instinct she possessed. "She doesn't trust them," Zara observed. She was willing to communicate with the park rangers, but whoever just arrived, she sees them as a threat. The young female on the table began to struggle again, trying to rise despite her weakened condition. Her maternal instincts were telling her to protect her unborn babies from whatever danger this new arrival represented. "Dr. Vale," the commanding voice called again, "we know you have 2 brown bears in there, including one that appears to be injured. For your safety and the safety of the animals, we need you to step away from them immediately." Kieran looked at the mother bear, whose eyes were now locked on the door with unmistakable hostility. He looked at the young female, who was fighting against her own weakness to protect her unborn triplets. He looked at the ultrasound monitor, showing 3 tiny heartbeats that depended entirely on the decisions made in the next few minutes. "Zara," he said quietly, "I think we're about to find out why the mother bear was so determined to bring her daughter here instead of to the Wildlife Rescue Center. I think she knew that not all humans can be trusted with the lives of her family." Outside, Dr. Martinez was giving orders to her team, and the tone of her voice suggested that their peaceful communication with the park rangers was about to become something much more dangerous. The mother bear looked directly at Kieran and made a sound that was unmistakably a question. "Will you protect us?" Kieran's answer would determine whether this extraordinary night ended in miracle or tragedy. "Dr. Martinez," Kieran called through the broken window, his voice steady despite the chaos of emotions swirling inside him. "I appreciate your concern, but the situation here is stable. The bears are not threatening anyone, and we're in the middle of critical medical treatment. Dr. Vale, you don't understand the full scope of what you're dealing with," Dr. Martinez replied, her tone becoming more insistent. "These aren't ordinary bears. We've been tracking this particular family for months as part of a research study, and the mother bear has exhibited highly unusual behavioral patterns that could pose significant risks." The mother bear's growl deepened at the mention of being tracked and studied. Her ears flattened completely against her skull, and for the first time since entering the clinic she looked genuinely dangerous. The young female on the operating table responded to her mother's distress by attempting to sit up again, despite Kieran's gentle attempts to keep her still. "What kind of research?" Kieran asked, though he was beginning to suspect he didn't want to know the answer. There was a pause before Dr. Martinez responded, and when she did, her words sent ice through Kieran's veins. "The mother bear was part of a cognitive enhancement study that was discontinued 6 months ago. She and several other subjects showed accelerated learning capabilities that exceeded all previous research parameters. We've been monitoring her behavior ever since to assess any long-term effects." Zara gasped, her hand flying to cover her mouth. "They experimented on her. That's why she's so intelligent, why she can communicate with humans. They did something to her brain." The mother bear seemed to understand that her secret was being revealed because she moved protectively closer to her daughter, positioning herself between the operating table and the door. But her eyes never left Kieran's face, and in them he could see a desperate question. "Now that you know what I am, will you still help us?" "Dr. Martinez," Kieran said, his voice hard with anger he was trying to control. "Are you telling me that this bear's enhanced intelligence is the result of unauthorized experimentation?" "The study was fully authorized by the appropriate committees," Dr. Martinez replied defensively. "However, the results were unexpected. The subjects developed problem-solving abilities and communication skills far beyond anything we had predicted. When we attempted to conclude the study, this particular subject escaped from the research facility. Escaped? Zara echoed. Or did she rescue herself and her family from being treated like laboratory animals? The young female on the table made a sound that was unmistakably one of pain and fear. Not physical pain from her injuries, but emotional pain from the memories being discussed. The mother bear responded by gently nuzzling her daughter's head, making soft, comforting sounds that seemed to calm the younger animal. The enhancement process had side effects, Dr. Martinez continued, and Kieran could hear her moving closer to the clinic despite his requests for her to maintain distance. Increased aggression, territorial behavior, and most concerning, the ability to influence other bears' behavior through some form of advanced communication. She's been teaching her enhanced abilities to other members of her family. Kieran looked at the ultrasound monitor showing the 3 tiny heartbeats of the unborn cubs, and a horrible realization dawned on him. You're not here to help them. You're here to recapture them for further study. And you want the babies too, because they might inherit their grandmother's enhanced abilities. Dr. Vale, you have to understand the scientific implications. No, Kieran interrupted firmly. You have to understand the ethical implications. These are not research subjects. They're a family trying to survive, and one of them is fighting for her life and the lives of her babies. The mother bear seemed to recognize that the conversation outside was becoming more heated because she began to pace again, but this time her movements were different. She was positioning herself strategically around the clinic, checking the windows, the door, even looking up at the ceiling as if calculating escape routes. She's planning something, Zara observed quietly. She knows they're going to try to take her family and she's preparing to fight back. But as Kieran watched the mother bear's behavior, he realized she wasn't just planning to fight. She was planning to flee. Her enhanced intelligence had allowed her to escape from the research facility once before, and she was already working out how to do it again, even with her injured daughter and unborn grandchildren to protect. "Dr. Martinez," Kieran called out, making a decision that could cost him his career, but might save 3 generations of bears. "I need you to listen very carefully. If you try to force your way into this clinic, if you attempt to tranquilize these animals, you will be responsible for the deaths of a mother and her unborn triplets. The young female is in critical condition, and any stress or separation from her mother could be fatal. Dr. Vale, we have protocols for handling enhanced subjects. Our team is equipped with the necessary equipment to safely tranquilize and transport all the animals." "Your protocols nearly killed her once already," Kieran shot back. "She was found in a trap, starving and injured, because she was so desperate to avoid your research facility that she took risks no normal bear would take. Your enhancement has made her too intelligent for her own good." The young female suddenly lifted her head and made a series of sounds toward the door. Not the same vocalization she had used to communicate with the park rangers, but something else entirely. Something that sounded almost like pleading? She's trying to talk to Dr. Martinez, Zara realized. She's trying to communicate directly with the person who wants to take her babies. Dr. Martinez must have heard the sounds, because she stopped talking for a long moment. When she spoke again, her voice was different, softer, more uncertain. That's not possible. The subjects in our study never developed the ability to modulate their vocalizations for different human listeners." "Maybe your research missed a few things," Kieran replied grimly. "Maybe intelligence, when it's enhanced enough, finds ways to grow beyond what any laboratory can predict or control." The young female continued her attempts at communication, and gradually, incredibly, Dr. Martinez began to respond. It was hesitant, broken, but it was clearly an attempt at dialogue. The sounds the research scientist made were clumsy compared to the young bear's sophisticated vocalizations, but the intent to communicate was unmistakable. "My God," Dr. Martinez whispered, and through the broken window, Kieran could see her approaching slowly, her hands raised in a gesture of peace. She's trying to tell me about her babies. She's asking me not to take them." The mother bear watched Dr. Martinez's approach with suspicious eyes, but she didn't growl or threaten. Instead, she made her own sounds toward the research scientist, sounds that carried unmistakable authority. The grandmother was making it clear that any communication with her family would go through her. What followed was the most extraordinary conversation Kieran had ever witnessed. 3 species, human, enhanced bear, and what could only be called naturally evolved bear intelligence, engaging in a dialogue about life, death, family, and freedom. Dr. Martinez, despite her scientific training and protocols, found herself drawn into a discussion that challenged everything she thought she knew about consciousness, intelligence, and the rights of enhanced beings. "She's telling me," Dr. Martinez said, her voice filled with wonder and growing distress. "She's telling me that the enhancement didn't just increase her intelligence. It increased her capacity for love, for fear, for hope. She feels everything more intensely than a normal bear, including the terror of having her family taken away." The young female on the operating table managed to lift one paw and place it over her belly, over the 3 lives growing inside her. Then she looked directly at Dr. Martinez through the window and made a sound that needed no translation. "Please, Dr. Martinez," Kieran said quietly, "you have a choice to make. You can follow your protocols and capture 3 generations of a family for further study, knowing that it will likely kill the mother and her babies. Or you can use your authority to declare this family off limits for research and allow them to live freely with their enhanced abilities." The implications of enhanced bears living freely in the wild, Dr. Martinez began, but her voice trailed off as she watched the young female struggle to stay conscious, watched the grandmother gently encourage her daughter to remain calm, watched the monitors showing the 3 tiny heartbeats that represented the future of this extraordinary family. But before Dr. Martinez could respond, something happened that changed the entire dynamic once again. One of the unborn cubs, the strongest of the 3 based on the ultrasound readings, suddenly moved in a way that was clearly visible even on the external monitors. And then, impossibly, it moved again in what could only be described as a pattern. "Dr. Vale," Zara said in amazement, I think one of the babies is trying to communicate too." The movements were rhythmic, deliberate, and when the young female felt them, she responded by gently tapping the same rhythm on her own belly. The mother bear picked up the pattern and tapped it out with her claws on the operating table. And then, incredibly, Dr. Martinez found herself tapping the same rhythm on the window frame. "4th generation," Dr. Martinez whispered. "The enhancement is being passed down, but it's not just inherited, it's evolving. These babies are developing communication abilities while still in the womb." Kieran realized they were witnessing something that science fiction writers had only dreamed of, the birth of a new form of consciousness that bridged the gap between human and animal intelligence. But more than that, they were witnessing a family using that enhanced consciousness not for aggression or dominance, but for love, protection, and the desperate desire to stay together. "Dr. Martinez," he said urgently, "whatever decision you make has to be made now. The young female is getting weaker, and those babies need their mother to survive the next few hours." Dr. Martinez looked through the window at the 3 generations of bears, at the monitors showing the struggle for life happening on the operating table, at the extraordinary communication taking place between species that should have been separated by millions of years of evolution. Then she made a choice that would change the course of wildlife research forever. "All units, stand down," she spoke into her radio. "Code 7. Research subject reclassified as sentient individual with full protection status. No approach, no capture, no interference with ongoing medical treatment." The relief in the clinic was palpable. The mother bear's aggressive posture relaxed, the young female's vital signs stabilized, and even the unborn cubs seemed to settle into calmer patterns of movement. But just as Kieran thought the crisis had passed, the monitors began showing something that made his heart race with panic. The strongest of the 3 babies, the one that had been communicating with movements, was in distress. Its heart rate was dropping rapidly, and on the ultrasound, Kieran could see that the umbilical cord was becoming compressed. "We're losing one of the babies," he announced, his hands already moving to prepare for emergency intervention. "I need to perform an emergency cesarean section to save it." The young female must have sensed the danger to her child because she tried to sit up again, this time with such determination that she actually managed to prop herself up on her elbows. Her mother immediately moved to support her, and together they looked at Kieran with eyes that held both terror and absolute trust. "Do it," the young female seemed to say through her eyes. "Save my baby." But as Kieran prepared for the most complex surgery of his career, operating on a conscious enhanced intelligence while her equally intelligent mother assisted and her grandmother stood guard, he realized that the night's miracles were far from over. Because the baby that was in distress, the one whose heart rate was dropping, had just moved again in that deliberate pattern. And this time, the pattern was different. It wasn't a simple rhythm anymore, it was a message. And the message was clear to everyone in the room, human and bear alike. "Help me, I want to live." Those words, unspoken but understood by every soul in the clinic, galvanized Kieran into action. He had performed hundreds of surgeries, but never one where the patient was actively communicating their will to survive while still in the womb. "Zara, prepare the emergency cesarean kit," he commanded, his voice steady despite the magnitude of what they were about to attempt. "We're going to bring this baby into the world." The young female seemed to understand what was happening because she lay back down on the table willingly, positioning herself to give Kieran the best access to her abdomen. Her mother moved to her head, gently placing her massive paws on either side of her daughter's face in a gesture of comfort and strength. As Kieran made the first incision, something extraordinary happened. The baby that was in distress suddenly moved with such force that it was visible from the outside, as if it was actively trying to help with its own birth. The other 2 babies responded by moving in synchronized patterns, their tiny heartbeats synchronizing with their siblings' rhythm. "They're working together," Zara breathed in amazement. "The triplets are coordinating to help save their sibling." Within moments, Kieran could see the baby through the opening he had created. It was impossibly small, covered in the protective membranes of birth, but its eyes were open and alert. As he lifted the tiny cub from its mother's womb, it looked directly at him and made a sound. The first cry of a being that had been communicating before it had even taken its first breath. The mother bear's reaction was immediate and overwhelming. She leaned over to see her first grandchild, and the sound she made was pure joy mixed with tears that actually fell from her eyes. The young female, despite her exhaustion, managed to lift her head to see her baby, and the connection between mother and child was instant and profound. But the miracle wasn't finished. As Kieran cleaned and examined the first baby, he realized that the other 2 cubs were also ready to be born. The stress of the surgery, combined with their siblings' early arrival, had triggered labor for all 3 babies. Working with speed and precision that amazed even himself, Kieran delivered the second cub, then the third. Each baby emerged alert and vocal, their enhanced intelligence evident from their first moments of life, and each one, impossibly, seemed to look directly at their human doctor with expressions of gratitude. The young female, now a mother of 3, was weaker than ever, but her joy at seeing her babies gave her strength. She made soft sounds to each cub, and they responded with their own tiny vocalizations. The grandmother bear moved carefully around the operating table, touching each grandchild gently with her nose, her entire body radiating pride and protectiveness. "Doctor, Vale, doctor." Martinez called from outside, her voice filled with wonder. The readings were getting on our instruments, the communication patterns between the family members. It's unlike anything we've ever recorded. Kieran looked up from where he was monitoring the new mother's recovery to see Doctor Martinez standing at the broken window, tears streaming down her face. "What you've witnessed here tonight," she continued, "it changes everything we thought we knew about consciousness, about intelligence, about the bonds that connect all living beings." As the first rays of dawn began to pierce through the storm clouds, the clinic fell into a peaceful quiet. The young mother was stable, her babies were healthy and nursing, and the grandmother bear had positioned herself as the guardian of her entire family. "Dr. Martinez," Kieran said softly, "I need your word that this family will never be separated, never be subjected to research again, never be treated as anything other than the sentient, feeling beings they clearly are." "You have it, Doctor," Martinez replied without hesitation. "In fact, I'm recommending that this entire area be designated as a protected sanctuary. What we've learned here tonight, it needs to be protected, not studied." The mother bear seemed to understand the promise being made because she approached Dr. Martinez's position at the window and made a sound that was unmistakably one of acceptance and forgiveness. The research scientist reached through the broken glass and, incredibly, the bear allowed her to briefly touch her massive paw. "Thank you," Dr. Martinez whispered, "for showing us what we had forgotten about the value of life, of family, of love that transcends all boundaries." As the sun rose fully, painting the clinic in golden light, Kieran realized that he had witnessed something that would change not just his own life, but the way humanity understood its relationship with the natural world. The young mother and her 3 enhanced cubs would grow up free, their extraordinary intelligence a gift to be celebrated rather than exploited. The grandmother bear, the escaped research subject who had risked everything to save her family, had not only succeeded in her mission, but had opened a door between species that could never be closed again. Months later, park rangers would report sightings of a bear family that seemed to understand human speech, that approached injured hikers to guide them to safety, that demonstrated problem-solving abilities that defied explanation. The cubs grew strong and healthy, their enhanced intelligence manifesting in ways that were beautiful rather than frightening. And sometimes, on quiet nights when the wind was just right, visitors to the Wildwood area would swear they could hear sounds coming from the forest. Not just bear calls, but something that sounded almost like singing. A lullaby shared between a grandmother, a mother, and 3 babies who represented the future of communication between all living things. Kieran never forgot the night a mother bear stopped a surgery to save her daughter and grandchildren. He kept the clinic's broken window exactly as the bear had left it, a reminder that sometimes miracles require breaking down the barriers that separate us from one another. The young mother's scar healed into a small mark that she wore proudly, a symbol of the night when love, trust, and understanding proved stronger than fear, stronger than protocol, stronger than the belief that some boundaries can never be crossed. In the end, it wasn't just 3 bear cubs who were born that night. It was a new understanding of what it means to be truly alive, truly connected, and truly family, regardless of species, regardless of intelligence, regardless of the differences that once seemed impossible to bridge. The mother bear had stopped the surgery not to prevent healing, but to ensure it happened in the presence of love. And in doing so, she had healed far more than just her daughter's wounds. She had healed the ancient divide between wild and tame, between human and animal, between the fear of the unknown and the embrace of the miraculous. The end